Today's topic is drainage bags. What do all of these drainage bags in my background have in common? They all collect urine, and you are to drain it and measure it for testing purposes. Now we're going to get into the various bags and how they're used. One I didn't add in the picture is the leg drainage bag. The leg one is maybe a lady's wearing a dress. It's more inconspicuous that you put on, and the patient may wear it while they're going out for a few hours. It's just a little less, gives them a little more dignity when they go out, as opposed to have the big drainage bag where they may have to have a cover-up bag if they don't have the drainage bag that has the cover built in. This is one of the methods that they would use. Now, when a resident wears a drainage bag, one of the things that they should have attached to their leg is called a stat lock. Some look like this, depending on the manufacturer. You may have it and it's attached to the patient's leg, and you put it on and you put the Foley catheter through there for support. There's two types of catheters that may be used in any setting. You may have an indwelling catheter, which is an indwelling catheter. They come in various sizes based on the patient's urethra size, and they have fluid that is instilled in there. Normal saline is usually, or sterile water is usually put into these. This one here, what you would do is, this is an indwelling catheter. You see that little hole there. So once this is inserted into the urethra, it's going into a sterile area. So it's a balloon we're going to put that fluid into, and the size of it is going to be on the side here. There'll be different colors, purple, orange. There'll be various colors based on the size of the catheter that's indwelling, and it'll tell you how much fluid to put in there. And you don't want to overfill these. These are normally done by nurses. These can cause trauma to a patient if they're pulled and tugged on. So we're going to talk about that in a moment. The next one here is a straight calf. You'll see these in your patients who have maybe some kind of neurogenic issue or paraplegic. They sometimes use these when they're going out, and these are just straight calf. You don't keep these in. They go in, they come out. But one thing they have to do is clean that area. So some patients, they'll put their betadine. You want to make sure that clean area, because you're going into a sterile area. The bladder is sterile, so you don't want to get any infection there. So you're going to clean that area before you insert the catheter, because it's going to keep down your infections. Once you have your catheter in place, you're going to put on what we call as a stat lock. A stat lock is what you put on the patient's leg. It can be one of these, or it can be the one that's Velcro and strap on. These are to keep the catheter stabilized while the patient's going, so it does not cause trauma to that particular area in the urethra. So when you're doing your state testing, this is the reason that you have to hold the catheter at the exit to kind of anchor it in so that it does not move when you wipe, because you're pulling, because that fluid is in the bladder, and if it pulls down, it can cause trauma and it really hurts. So you want to be very, very mindful when you're doing catheter care. Now let's get back to that drainage bag. The drainage bag is where the urine is being contained in, and it's going to have an outlet valve that you drain the urine into a graduate cup of some type of measuring device if it's in order for it to be measured. For state testing purposes, you are going to be draining the urine into a graduate cup to measure it for your testing. Now, when you measure that urine, the one thing I see a lot of the students do, they're cleaning the outlet port before they drain the urine bag. It does not say that in your skill set. It says to clean it afterwards. So I try to explain to people that you do not have to clean it before you start, unless there's an order for you to clean it before and after. But for state testing purposes, you do not have to clean that outlet port prior to testing, before you even empty the urine. Why are you doing that? Because you're getting ready to empty dirty urine So why would you clean it? You're cleaning it afterwards. So it should be clean before and after you start. So before you start and put it back in that housing, it should already be sanitized, wiped down with your alcohol wipe. So you do not have to start with cleaning with an alcohol wipe to start draining the bag. If you look at your mock skill, it does not say anywhere on there that you have to clean it first. I know it's taught that way, but it's kind of waste of supplies to do so. All you have to do is clean it after it is drained. That is what the state is looking for. I hope this is helpful. Please click like, subscribe, and share. I will be bringing you tips of how to practice safely and pass your test on your first attempt. Thank you and have a nice day.